Hello, this is my post-op video. Crazy. Yes, I am now post-op top surgery. I had surgery on the 22nd of June, so it's actually my 2-week post-op video really. I had it with Mr. Kneeshaw at Castle Hill Hospital in Hull. I had a slightly different procedure to what most guys will probably go for. I had a purely liposuction procedure, and I will have a nipple resizing procedure at a bit of a later date. But the reason Mr. Kneeshaw and myself decided to go for just a liposuction is because I literally had more fatty tissue than breast tissue to take out, and he didn't want to start cutting me open when it wasn't necessary to do so. So for the most non-invasive procedure he could offer would be liposuction, so we went ahead with that. Everything went fine. My friend Ellie took me down to the hospital. I stayed in overnight because I live about 3.5 hours away, so they decided to get me in a day earlier. Stayed in overnight, had the surgery on the Monday afternoon, went down about 2:30, was back in recovery by about 4:30, so it only took about 2 hours to actually do, and I was absolutely fine. I wasn't sick, I wasn't in a lot of pain. All the nursing staff was brilliant. I had my own room. But yeah, so at the moment I am wearing a compression bandage because I don't have any drains. Mr. Kneeshaw didn't want to give me drains, so I have to wear a compression vest, and I have to wear it for 6 weeks. First week I had to sleep in it. I had to wear it 24 hours, and it was an absolute ball ache. And then the week just gone has been probably the warmest it has been in England for a very long time, and very uncomfortable. So I'll get on to how the results are looking now. I was very swollen and very bruised right after surgery, and it's one of the main reasons why I didn't make an update video, because I was so swollen and so bruised. I actually looked bigger than I was pre-surgery, and I'm not going to say I was disheartened. I just didn't see the results that I think most guys see as soon as they have surgery. I wasn't expecting that much swelling, and it freaked me out a little bit, and I didn't really want a lot of people to see my chest at that point, but all the swelling's still there. The bruising's gone down a hell of a lot. Yeah, I'm starting to see changes now, looking at pictures. I know I'm very early on in the game at the moment, recovery wise, and there's still quite a lot of swelling to go down, but the bad swelling, the bad bruising's gone, so I'm feeling a little bit more okay about it now. But I will show you what it looks like, and I'll also probably put in some photos of a couple of days after surgery, just to show you what the bruising and swelling was looking like. So I'm just hoping no one's looking out of that window. We'll have it. So this is the compression vest that I've got to wear. It's very uncomfortable. I wasn't thinking that I was going to have to wear anything afterwards, but it does help with swelling, I'm not going to lie. I took it off to wash it the other day, and obviously I wasn't wearing it all day, and the swelling was a lot worse than when I'm wearing it. The swelling's not that bad in the morning either, so I haven't actually taken this off all day, so I'm just hoping no one's watching out the window, so I will show you. Do a striptease. So it's just like a Velcro thing. This is what my chest is looking like at the moment. So that's what we're looking at the moment. It is flat, pretty much. So that's what we're looking at. So this is 2 weeks post-op. These bandages are just where the stitches are, where the liposuction probes went in. So this is kind of, yeah, you can see like the stitches. Ooh, take that down a bit. That's a stitching. That's just some, yeah, this is stitches where the liposuction thing went in. This side has a little bit more swelling on it than this side. It's quite tender and sore over in this area here. As I said, I am going to have nipple resizing done at a later date. Mr. Kneeshaw didn't want to do anything just right now because he wants the swelling to go down and then to have a look at where they're going to sit. But it's a little bit numb still around this area, and this side's coming back a bit more, but not too bad. Bit of swelling up on the top. But yeah, I am happy with it. every day it's starting to look a bit better than it was beforehand. This is going to be my chest pre-op to 5 days post-op pictures. So my pre-op 3 days and 5 days, and as you can see I was pretty bruised and pretty swollen, and at that point I actually felt a bit bigger than I was pre-op, so that's why I didn't want to show my chest off so much. But the picture's coming up in a second, showing my 2-week post-op, and you can see a big difference now that the swelling's gone down, the bruising's gone down. So yeah, I am really happy with the results now. I go back and see Mr. Kneeshaw in 3 months. I can stop wearing that horrible compression vest thing in another 4 weeks. I'm back at work now, I only took 2 weeks off work. Yeah, quite happy with how it's looking, and I think it's going to, once the swelling goes down and everything, it's going to probably look a little bit better, and I'm going to start trying to work out my chest muscles a bit more. Definitely recommend Mr. Kneeshaw. He's a really nice guy, he's really nice to talk to. He's some of the other procedures, he does double incision, he does the keyhole as well, and he's had really good results. I know a couple of guys that have gone with him for both those procedures, and he's done really good jobs on those. So yeah, definitely recommend Mr. Kneeshaw. I'll probably do a bit more of an update as things start to settle down a little bit more. I mean, now I'm only 2 weeks in, so I'll probably do like a month and then so on, with how things are healing, and obviously when the nipple resizing happens. But yeah, happy with the result. I think it looks quite good at the moment. So yeah,